Hi, my name is Katia Bergeron, and I am a full-time teacher at the University of Iowa College of Dentistry. Today, I want to share with you a case that I did with Filtex Supreme Ultra, a young patient about 20 years old that came to our clinic with two broken front teeth. He had fallen the night before, and he broke teeth that were previously perfectly intact. What we did on the first appointment is we took impressions to be able to wax up the case and fabricate a mock-up. We placed some temporary glass ionomer restorations, and we sent him back home with an appointment for the next day. When he came back the next day, we were able then to place the final restorations. So on the day of the restorative appointment, here's how the teeth look like. Smaller fracture on tooth number 8, but a very large, extensive fracture on tooth number 9. And as I said before, these teeth had no previous restorations. The adjacent teeth also are perfectly intact. To be able to do good shade selection, the first thing is to look at the adjacent teeth, the natural teeth, because this is really what we're trying to mimic. When we divide a natural tooth in 3 segments, the cervical, middle, and the incisal third, we quickly see that a tooth is always polychromatic. The incisal third is typically very translucent and will show some effects. One of the most common effects is the halo effect, so the white line at the tip of the incisal edge, especially on teeth that do not have much incisal wear. The middle third has a medium opacity, whereas the cervical third is typically very chromatic, so the color is very saturated and it's much more opaque. We really have to do shade selection according to the area we're going to restore, the location of the planned restoration. Clearly here, the fracture line is very, very defined, and if we don't do a proper bevel prior to the restoration, the transition between the restoration and the tooth will show very clearly at the end, and we will never be able to mask that transition. The facial bevel is done first with a flame diamond burr, and then it is blended to infinity with a Softflex disc. The facial aesthetic bevel is a long bevel. We're talking here more than 2 millimeters bevel. It should be scalloped, so no straight line, and it starts indented, so it starts beyond the DEJ, but it also blends to infinity. On the lingual side, the bevel is just a straight line, about 1 millimeter long, so a very simple, regular bevel, 45 degrees, 1.5 millimeter, very standard bevel. One other important thing to do is to make sure we do not have any sharp angles in the preparation. The first step will, of course, be to etch and bond some resin to the teeth. Once this is done, we are ready then to do our first layer, and this first layer will be done with the lingual matrix that we fabricated on the model we got. I'm making sure here that my lingual matrix fits well, that it adapts well to the teeth. Then I am ready to place the first layer of composite into that lingual matrix. The first layer needs to be very thin. So in this case, because my basic shade that I had selected at first was A1, I'm going with A1 enamel. When I talked about having a thin layer, I'm really thinking in terms of having less than 0.5 millimeter here. So it needs to be pretty thin. I place it directly in the putty matrix, bring the putty matrix to the tooth surface, adapt it really well, use an instrument to make sure my composite is well adapted, well attached to the tooth, and then once it's in place, just cure it there. After it's cured, we simply remove the lingual matrix, and we have created a lingual shell. I just cure that layer, and I am then ready for the dentin buildup. the dentin buildup is a much thicker layer, and it has to be done with a more opaque type of material. This dentin buildup should be carried partially over the bevel, but not completely. We have to keep in mind that this layer is the one that masks the transition between the composite and the tooth structure. This layer should also not be carried all the way to the incisal edge because we need to make sure we leave enough room incisally for a more translucent material. The next layer will be that incisal translucency, and we would then use an incisal shade such as clear translucent. This is the shade I used for this specific case. So clear translucent was placed incisally to create again the high translucency effect, and it must not be too thick of a layer because we don't want that layer to really go all the way to the surface of the restoration. After the incisal layer, it is time to add some enamel effects if it is needed. After curing of those white tints, it's time for the final layer, which will be done here with the basic shade A1, and since it's enamel, a translucent layer, A1 enamel. And this layer covers the whole restoration, and it even goes beyond the bevel. This final layer is contoured to the final shape we want to give to the restoration. So care must be taken here to start placing developmental grooves, to have the proper embrasures as well. With an IPC instrument, with any type of contouring instrument, we need to make sure we have a nice final contour to minimize finishing procedures as much as possible. A brush is always used as the final touch to that surface layer. Restoration of the second tooth will be carried in a very similar way that what we did for tooth number 8. So the first steps are all the same: etching, bonding. You may have noticed that when I'm etching and bonding, I am placing celluloid matrix strips to make sure that I'm not etching and bonding the adjacent teeth. So I'm protecting the adjacent teeth when I do that. But right after the bonding steps, these strips are removed. And after etching and bonding, we go with our lingual matrix. So again, this is done in the index, in the putty matrix index. A1 enamel, very thin layer, attached to the tooth with an instrument, cured in place, and then this putty matrix is removed. We end up with a very nice lingual shell. For this, I will place a matrix strip. I'm using a metal one here. It could be a clear one. I just prefer very often the rigidity of the metal matrix. And I'm not going to leave it there. I'm going to pull through just to make sure, I'm just making sure here that I have no voids interproximally. Again, since these are proximal surfaces, we want to go with an enamel-like type of material. So A1 enamel, the same as the material we use for the lingual shell. Distal contact is created first. So a little layer of A1 enamel is placed along that matrix, and then with an IPC instrument, it's contoured. I make sure that gingivally I have no gap, no voids at all. And before I cure, I will actually pull the matrix through the contact. So remove it completely by pulling towards the lingual, making sure that all the proximal is filled, that we have no voids at all interproximally. Right away from this step, we're trying to develop proper embrasures. Mesial contact is developed with exactly the same technique, same thing. So metal matrix in place, small layer of A1 enamel, pull through the matrix here, and then end up with really a complete shell at this point. So with the incisal view, we can clearly see now that we have basically an empty shell, but we already have good facial embrasures, good incisal embrasures as well. So it's just a matter of filling that now with proper opacity of material, but the contours are already there. We already have a lot of references. Dentin buildup will be our next step. So we want to go here with a more opaque type of layer and also a more saturated color. So my basic shade was A1. I'm going to switch for an A2 now. Go with a little bit more dark since it's dentin. It's a much thicker layer. How thick? The thickness of natural dentin. We want to make sure that we leave enough room for the surface layer, the enamel surface, which would be between 0.5 millimeter and 1 millimeter at least, that we want to keep for that surface layer. Cover the bevel partially. Make sure you do not carry this layer all the way to the incisal. Cure those white enamel effects, and then it's time to do the incisal buildup with the highly translucent material. Let's go with the clear translucent as we did for tooth number 8 here, making sure again that this layer of clear translucent does not go all the way to the surface of the restoration. We are ready for the final surface layer, the enamel layer. A1 enamel is our basic shade, and we are going basically to cover the whole surface of the tooth here, finishing the A1 enamel cervically to nothing beyond our bevel there. That layer typically may take a little bit more time because this is when we want to create our final contour, our developmental lobes, and really our nice embrasures, nice surface, because we don't want to have to do much finishing. We certainly don't want to have to, or we don't want to remove all the characterization that we placed with the finishing procedure. So all the thickness of these individual layers really needs to be accurate to minimize finishing procedures. In terms of finishing, the first step is to use Softflex disc. With the Softflex disc, we adjust the length or refine it if necessary, as well as the incisal and facial embrasures. After the Softflex disc, we usually go with a diamond, a flame diamond, a fine diamond, to define or to really get the final contour of the facial and the lingual surface. Now it's time to create the developmental grooves and create the surface texture. Once this is done with the diamond burr, the texture, the surface characterization, the final facial contour, a little bit of just refinement of those margins with the 12 blade is usually indicated, and interproximally, if the contacts feel rough or if they feel a little bit too strong, then we can go with a diamond strip, a fine diamond strip, followed by any type of polishing strips to really get a smooth interproximal surface and a contact that has just the right strength. Once all the contour matches well the adjacent teeth, the surface characterization also, then it's time to go with polishers. Fine grit and then an extra fine grit is used to really bring the material to a high shine. This is definitely one of the most important advantage of a Supreme Ultra, the fact that we can polish it easily and quickly as well. Finishing the restoration to proper contour to match the adjacent teeth and bringing the composite to a high shine, to a high luster, will really give us pleasant results and very aesthetic results.